tea, coffee, chocolate, and cola drink. There is no history of easy bruisability, bleeding from the nose, mouth, gum, blood transfusion previously. Chronic indigestion, pitta intake, passage of the worm in the stool, perianal itching. There is no history of high-grade fever with yellowish discoloration of eyes and skin, low-grade fever with evening rise of temperature and decreased urine output. There is no history of overcooking of food. She did not receive tetanus toxoid prophylaxis. According to the patient, her abdomen is growing according to her gestation and she perceives normal fetal movement. There is no history of lower abdominal pain, vaginal discharge, bleeding, and burning micturition. For this complaint, she presented to the outpatient department of Sheikh Zayed Hospital in Himya Khan and was admitted. Her blood and urine test was done and her hemoglobin was low, which was 5 gram per deciliter, and she was transfused 1 pint of blood. Her further plan of management was not discussed with the patient. Her age of menarche is 30 years. She having regular menstrual cycle of 7 days after every 28 days and soaks 4 to 5 homemade sanitary pads. There is no history of dysmenorrhea, dyspareunia, intermenstrual bleeding, and postpartum bleeding. Couple never practiced any method of contraception and pap smear was never taken. There is no history of hypertension, diabetes, asthma, tuberculosis, chronic liver and renal disease in her and in her family. However, her father and brother is non-smoker, non-addicted, non-alcoholic, she is non-smoker, non-addicted, normal bowel and sleep habits with no known drug and food allergy. She took tap water and there is no history of barefoot walking. Her husband is a driver and earn about 18,000 per month. She lives in a rented flat of 3 rooms with 9 family members and meet with daily necessity of life with difficulty. On examination, 26-year female, well-oriented,